discuss regarding the female pelvis. So the female pelvis is called as gynecoid pelvis. So the gynecoid pelvis is made up of 4 fused bones. So the 4 fused bones are the 2 inanimate bone, the sacrum and the coccyx. So this altogether the bones of female pelvis are 4, that is inanimate bone, sacrum and coccyx. Now the inanimate bone is again divided into 3 fused bones, that is the ilium, ischium and the pubic bone. So when we see the parts of ilium, this depression which we can see is the iliac fossa. This is the iliac crest. This is anterior superior iliac spine, anterior inferior iliac spine. This is posterior superior iliac spine and the posterior inferior iliac spine. This is the greater sciatic notch and this is the lesser sciatic notch. This is regarding the parts of ilium. Coming towards the parts of ischium, this is the body of ischium. This is the ramus of ischium. This is ischial tuberosity and this is your ischial spine. The 2 spines are there. This is the ischial spine. Coming towards the parts of pubic bone. So this is the body of pubic bone and this is inferior ramus and this is your superior ramus. So the inferior ramus of pubic bone interconnects with the ramus of ischial tuberosity. Now coming towards the parts of sacrum, this is the sacral promontory, this is the ala of sacrum, this part is the coccyx as you all already know, and these are the foraminas for the nerve passage of the nerve endings. Now coming towards the landmarks of the female pelvis. So the landmarks, we will start with the symphysis pubis. This is symphysis pubis. This crest like portion is the pubic crest. This is the pubic tubercle. After pubic tubercle, this is pectineal line. This is iliopectineal eminence. This is iliopectineal line and this is sacroiliac joint. This is ala of sacrum and the sacral promontory. This is about the landmarks of female pelvis. Now coming towards the joints of the female pelvis. So there are 4 joints of female pelvis. 2 sacroiliac joint, the joint connecting the sacrum as well as the ilium bone is the sacroiliac joint. The joint connecting the 2 pubic bones is called as symphysis pubis and the joint between the sacrum and the coccyx is your sacrococcygeal joint. Clear? So this was regarding the joints. Coming towards the landmarks of female pelvis, ligaments of female pelvis. Ligaments are, the ligament connecting the sacrum and the ilium is sacroiliac ligament. The ligament between the sacrum and coccyx is the sacrococcygeal ligament. Ligament between the sacrum and connecting the ischial spine is the sacrospinous ligament, and the ligament connecting the sacrum and ischial tuberosity is the sacrotuberous ligament. So this is regarding the ligaments of the female pelvis. Now we will discuss the parts of female pelvis. So the parts of female pelvis, it is divided into 2 parts, that is true pelvis and false pelvis. The part which is participating in the delivery process, that is this part is called as true pelvis, and the part which is not participating in the delivery process is called as false pelvis. Clear? Now this true pelvis is again divided into 3 parts, that is this is called as the brim of the pelvis or inlet you can call, and this is here the cavity and this is the outlet. So the true pelvis is divided into 3 parts. Now when we discuss the diameters of pelvis, the diameters are seen in 3 planes, that is anteroposterior diameter, this is the transverse diameter and this is the oblique diameter. So all these diameters are seen in all these 3 parts, that is your brim, cavity and the outlet. So first we will discuss the diameters of the brim. So when we discuss the diameters of the brim, and the anterior posterior diameters are 3, that is anatomical conjugate from the center point of the sacral promontory to the upper outer border of the symphysis pubis. This is called as anatomical conjugate, which is 12 cm. Now the distance between the center of the sacral promontory to the upper inner margin of the symphysis pubis, the distance is 11 centimeter, which is called as obstetric conjugate. And this is importance in the obstetrical or the delivery process, because this 1 centimeter is minimized in the symphysis pubis joint. Now the distance between the center of the sacral promontory to the outer inner border or lower border of the symphysis pubis, this is called as the diagonal conjugate. So all these are the anteroposterior diameters of the pelvic ring. Coming towards the transverse diameter, the transverse diameter is the farthest points of iliopectineal line. The distance between the farthest points of iliopectineal line is 13 centimeter, and that is the transverse diameter. And the distance between the sacroiliac joint to the iliopubic eminence, that distance is called as the the oblique diameter of the pelvic ring. Coming towards the cavity, as we consider the cavity as round, all the three diameters, that is anteroposterior diameter, transverse diameter and oblique diameters are same, that is 12 cm. Now coming towards the diameters of the outlet. So when we discuss the diameters of outlet, the distance between the lower border of symphysis pubis to the sacrococcygeal joint, that distance is called as anteroposterior diameter, that is 13 centimeter, and the distance between the two ischial spine is 11 centimeter, that is your transverse diameter, and the distance between the center point of obturator foramina to the center of sacrotuberous ligament, sacroischial ligament is the oblique diameter, that is 12 centimeter. These are the diameters of outlet. Clear everybody?
Yes, ma'am.
So this was regarding the female pelvis. I hope this video will help you for the future. Thank you.
Thank you, ma'am.